So we know the world faces significant development challenges. It's in our newspapers every day. We also know that we've got some really cool solutions to these challenges. But we can't, with the resources we have, implement all these solutions at the same time. We need some way of sorting them out, some way of prioritizing. To say something simply we should be done because it's a good idea is true, but it doesn't help us distinguish amongst good ideas. There are a number of ways we can tackle this problem. One approach, which is used by the Copenhagen Consensus Center, is to ask researchers to calculate something called benefit-cost ratios. In other words, for a particular good idea, how much would it cost us to implement, and what would be the economic benefits or the economic returns for doing so? As part of their current initiative around looking at our progress towards meeting Sustainable Development Goals, they asked a whole group of sets of researchers around the world to actually construct these estimates for different types of outcomes, different types of interventions. So for example, there's work done on best bet interventions to reduce tuberculosis, to improve childhood vaccination coverage. But it turns out that one of the really excellent investments is to replace iron folic acid supplements from pregnant women with multiple micronutrient supplements. This produces a benefit-cost ratio of 37:1. In other words, for every dollar we spend on this, we get a $37 return. And that's on par or better than investments in lots of other development areas, including being on par with work we can do around childhood vaccinations, certain types of schooling interventions, certain interventions that will reduce corruption, improve government procurement. In other words, oftentimes we think of nutrition as nutrition interventions in terms of the direct nutrition and health benefits, but it also turns out that some of them can be really excellent economic interventions as well.